Hey guys, this is Sriram, Sullia. Welcome to a brand new series called What's Up Doc, where we'll be having conversations with some of the most interesting doctors in the city. Today we have with us Dr. Manohar Kn, MD, GNB, MNAMS, Triple FRCP from Edinburgh, Glasgow, and London, consultant physician and diabetologist from Manipal Hospital, Bangalore. He's an examiner, MRCP UK from PACES. He's also the medical director of Disha India Foundation. Dr. Manohar, how are you? Thank you so much for being here. All well?
Namaskara. Nice to be here actually. I love this place. It's totally different from what I do daily.
Right. It's good to have you with us. How are you and how are you since March 2020?
I think everyone would say they are definitely better from where they left it in March, isn't it? Things suddenly changed 2-3 months into the new year. And then if someone had told us at the beginning of a year or sometime back, such a situation would arise, maybe would have thought he's a psycho, isn't it?
Yeah.
In the current situation with the technology what we have, a virus which is unseen had kept the globe standstill, isn't it? Well, March was that way in India, if you look at it, and then the lockdown, a sort of preparation to what was expected to come by. Honestly, we have done well there, I think. Bits and pieces, there would be problems, but by and large, I think we have done well. And then we were always worried that US couldn't do well and UK didn't do well. Most of the Europe struggled it. How would India do? Keeping that in the mind, keeping our population and diversity in mind, I think we are doing well. From where we started, it could have only got better, isn't it? I hope like these fairy tales, it should end like they happily lived ever after.
Something
like
after
that.
from there.
Yeah.
I
hope
mean,
so.
hope, and that's what we are all optimistic about.
Yes.
Doctor, you recently took a break
Yeah.
from a very arduous last 9 months where you were working so hard. I remember meeting you when you were so very stressed with all the work. Your phone would ring non-stop. That's the kind of scenario that you were in. And talk to me about the kind of impact it has had on your professional as well as your personal life.
Yeah, tough situations call for tougher people to put up their hands, and it's not only me. Innumerable people. I think no words can thank the people who have come forward to work in this catastrophe.
Mhm.
May it be general public, may it be the healthcare professionals, not only doctors. I think the nurses, Anganwadi workers, Asha workers, police personnel, some of the government officials. We always take pride in criticizing them, but the way they have done, even the ministers, they have done worked overtime to get us to this sort of a situation, which is definitely good. Yeah, think of things. Did we ever think that this situation would come? Well, in some other profession, let's say like maybe in the army or the navy, sometimes you are taught or made to believe that you may go into such situations. Medical field, I don't think ever in fact, I was joking to my friends like coronavirus, there were only 3 sentences about it, which we never studied. RNA virus, influenza-like illness, rarely causes problems. These were the only 3 words
Read in
3
the
sentences
textbooks.
we knew about coronavirus. Now, all of a sudden, like coronacrinology has become a topic, a speciality in itself. In our medical groups, we discuss this situation much, much more than any other problem. So that is what the impact this has left. And hats off to all those people who have come forward, and even the media. Of course, we always do this blame game, but awareness when it was there, media support is of utmost importance, and they've done their work very well. But now again, we see like, if you are to look at it this way, like there was a lot of interest,
Yeah.
anxiety, and uncertainties about this epidemic. And slowly it is coming down. It's a natural way. However important the topic is, how long can you be glued to it?
Yeah.
Somewhere we need to balance life and livelihood. That also comes into play.
True.
I think now we are talking less and less about it.
Yeah.
But as you are alluding to it, we already see a lot of second waves worldwide
Yeah.
in some
Yeah.
cities in our country
True.
also.
We'll talk about that in detail as well. You're right in saying that people definitely have their masks up, they have their guards up, but
Yes.
are we being as careful? Are we being as paranoid as we were at one point of time? And should we be? I thought we need to answer these questions. Before we get to that, Doctor, talk to me about the survey which you had mentioned about. I found that to be very interesting. So you and a psychiatrist friend of yours actually put out a survey to find out the kind of stress a doctor has had to endure during the times of the pandemic and what that would actually affect to. What exactly was that study about?
Well, straight from the heart, we call it as this pandemic started. I could sense what is coming. It was holidays for the kids. So I sent my immediate family off to their native place and told them to stay put. And then we started looking at how it is behaving in different parts of the world, started affecting us. I was all alone at home. Of course, my brother and my mom would help giving food. It was like go outside, receive the food, have, clean it and give it back. Totally a different experience. Then few days went by and it started affecting me very badly. I was getting anxious and restless. I was thinking some doom is going to happen. And we all knew that frontline workers' risk of death was 10 times more than the general public.
Yeah.
And we can't run away from the battlefield. So it was starting affecting me. And I still remember about 2:40 early morning, I was not getting sleep. And I texted my friend, who's a psychologist, Satish, to say that it's affecting me so badly. And I'm sure it would be affecting many others also this way. So why don't we do a survey? Then, of course, next early morning, he replied, this is a great idea. And when we looked at it, whatever survey of mental health assessment in the world it was only for 200, 400, 500 people. So I rallied with my group, Disha India Foundation. We have good colleagues of ours who shoulder to shoulder, we work together, and that makes a lot of difference. So we could get feedback from 2,000 odd healthcare professionals in different categories, not only just the physicians, different specialties of medical, nurses, physiotherapists, students, and different special pharmacists. So we included all this and we have brought out as, it has been submitted to the international journal, which it would be the largest survey of assessment of mental health status among healthcare professionals. Up to 50%, 52% of us healthcare professionals who are taken part in the survey showed a lot of features of anxiety, sense of impending doom, uncertainties, and the stress, post-traumatic stress disorder like symptoms were there. Fortunately, we didn't stop at that. The psychiatrist colleague of ours were very, very proactive, and we started to form a group and reached out to many of the healthcare professionals, mostly the less sung heroes or heroines like the nurses and other paramedical healthcare professionals, and we could counsel few of them and try to make some difference there. So that was one of the important things I feel I have achieved in this. In uncertainties, in adversities, it provides opportunities also.
That is fantastic, and I'm sure the kind of positive impact it has had on these individuals is tremendous. And these are the people that we rely on so very much during these times. Well done, Doctor. I mean, I really appreciate how you've done this above and beyond what you generally do as a doctor, as a consultant physician, as a diabetologist as well. Let's talk about the present day reality. We don't hear that much about stats and figures about how many people are infected. In fact, I recently read about the number of containment zones from close to about 4,000 have now come to 4 or something like that. So what is the present day reality and how are we faring? How are we doing?
Yeah. This COVID illness is a elusive moving target is what I always tell when I talk to medical professionals. What we understand today becomes a bit obsolete and not correct after a few weeks. Containment zones are off now. There were containment zones, then they shrunk it to the household, not even the apartments. So containment zones are out. However important or impactful the topic is, if we keep on discussing it again and again, I know it's a matter of life also, still people will get that mental fatigue there.
Yeah.
So I think that is what has set in. And I always felt that this pandemic will test health facility definitely, but humanity, health economics also. Somewhere people need to draw a line between livelihood and leading their lives with so much fear. I think somewhere economics had to come into play. We saw in the early parts of lockdown when people who were working in cities from rural areas, they were helplessly going back to their places, and they suffered such a, I think the losses could be much more than what COVID would have done retrospectively if you think at it. Maybe we didn't take into account this sort of a situation would come. So somewhere we need to move on. I think that is also there, but somewhere we need to balance it also. If we try and act as if COVID is a thing of past and try to be too relaxed about it, we know already some parts of the world are again getting into lockdown.
Yeah.
Some, of course, ray of hope, vaccine is coming. Again, we'll talk about it later. But then there should be some sort of responsibility on myself individually and towards the community also. Then only this can be contained. So I know the worst hopefully is over. But if we tend to relax, I hope it doesn't come back in a circle and haunt us more.
Yeah.
So what I would like to urge here is, yes, we can't be living in fear, but we can move out in limited and very, very important activities we can indulge. But please take all the precautions. Please do not let your guard down. This is the time. If it hits second time, it's worse. And from what I hear from my friends abroad, and even in some parts of our country like Delhi, it is as bad or even worse than the first wave itself.
Wow. Yeah, and you are right. Many countries abroad, right from the US to parts
Canada.
of Europe, yes, have been shutting down, seeing the number of cases rise up as well. You think we may enter that situation, or we may have to?
I wish we don't. But then if you look at it in the early part of the pandemic also, Delhi and Mumbai peaked early, and a lot of us were talking about the Karnataka model or the Bangalore model. But unfortunately, with time, there was no scope for it, and we still saw the surge in cases in our city and in our state. So possibly, even when we discuss among our peer groups, we definitely feel there could be some rise, some wave, possibly by Jan-Feb.
Okay.
So, but again, that's why whatever work we do now in spreading awareness and trying to hold the guard, possibly we would have a much smaller peak. I hope we learn from others' mistakes. We don't want to make all the mistakes by ourselves and keep learning from it, isn't it?
That's
So
true.
let's learn from other part of the world, some part of our countries which are already affected in second wave. And if we can avoid it, nothing like it.
Doctor, let's talk about the vaccines that so many people are eagerly waiting for, and we are all expecting to see how this is actually going to pan out as well. We've been reading about how 95% efficiency, it's almost there. But it's not that easy, right? It's not as easy as here you go, vaccine, and then it trickles down to the rest of the country. What exactly does this involve, and how do you think a vaccine can actually solve this?
So vaccine, how does it act is by ways of mechanisms, we make the virus impotent, to call it, to cause the disease, or we take a fragment of the virus and make human body to elicit a response. So this response by the human body gives us a protection against the disease. So that is what is vaccination, in short. So of course, if you look at the histories of vaccination, we have vaccines for very handful of diseases also. Not all diseases have vaccination. The fastest vaccine to hit the market till now is just 8 years. It's not few months.
Just 8 years.
Yes. So, of course, now there is a very stringent methodology to approve any vaccine or any drug for that matter. Because the dictum in medicine is primum non nocere. Don't do any harm. This is the first dictum in medicine. So, trying to speed track, we should not end up with a catastrophe. But of course, many authorities have taken this into account, and they have definitely had to speed track. We can't handle this again and again. But then there could be some concerns. Definitely in the early part of the vaccine trials, there were concerns that some neurological affection would happen to them. It can happen with any vaccine, even though I say mumps was the fastest. We have vaccines for the common flu. When you take it, sometimes people can have mild fever, mild body ache. We know we hope we know the treatment of coronavirus to a large extent now. But we don't know how to handle the vaccine-related side effects as effectively as we know the disease, which itself is not foolproof. So yes, I'm eagerly awaiting for the vaccines. From what we learn is there are 4 or 5 types of it. They claim efficacy 90 to 95%. Well, if many of us take it, they say it is 2 doses, 4 weeks apart. Again, controversy over first it should be a half dose and then a full dose. As we know, this is an elusive target. We don't know much about the virus as definitely as we knew about some other diseases. So all in all, it is a ray of hope, but I hope it is as much useful as in other cases. Someone also questioned that most other vaccines are 60, 70, 80% effective. How come you have a 95% effective or 90+ percent effective vaccine? But there are multiple companies. I hope not everyone could go wrong, and we are looking forward for it. But till it is proven, till it is you've taken the vaccine, both the doses, we should not forget the SMS or what it has been highlighted, the social distancing. Actually, it should be physical, not social. We need to get closer socially and distance physically. Masking and sanitization. These are the definite vaccines which will work. Vaccines, other vaccines, I hope they work, and they will most likely work. But exactly to what extent, only time would tell.
We live in a world of instant gratification today. And I'm sure people did expect a vaccine many, many months ago. You work with a leading hospital and you have treated some of the biggest dignitaries. What was that scenario like when you have a very powerful person in a hospital and everyone's running around making things work? And in a situation when the doctors are also
overwhelmed.
Yes, overwhelmed.
Every person I treat is a VIP, is always I tell. Everyone is the same. But of course, the VIP culture is deep-rooted in our country for long, isn't it? Do you know who I am? Is the usual question. Even if you meet anyone in the roadside, let alone a big officer or a politician. Well, especially when the things are already overwhelmed, yes, it was tough. But again, most of them were very understanding. Everyone knew that this is something unprecedented and they were very cooperative. Of course, some here and there lighter incidents would happen. The real challenge is how to interact with the immediate family, the party workers, the media. And of course, our hospital is very well known and we have dealt with such people very well and from a long time. And we have a good boss who has taken charge on it personally, and we handled it quite very well is what I felt. But otherwise, already overworked health force or task force. It was a bit more of a challenge, but we could still manage it.
Right. Talk to me about how when the medical system gets overwhelmed, you have various doctors who may not be involved with that particular discipline, who may have to chip in sometimes. And that is something that we actually got to see this time.
Very valid question, I think. We used to joke in our medical communities, if not in other social communities, that stay home, otherwise a gynecologist will intubate you or an orthopedician will intubate you or something like that.
Medical
jokes. We ourselves would think, I don't want that to happen. In fact, for that matter, I'm a physician working in a leading multi-speciality. So the physician role shrinks there because there are specialists for everything. I can't remember consistently wearing a glove. In a year, 5-10 times I would have worn it. But now I was in the full suit. So it is new to the physician, infectious disease, pulmonologist also. And thanks to our friends, medical professionals who are in other specialities, they all chipped in, they volunteered to work with us. Otherwise, this wouldn't have been possible to be dealt in the way we have done it now. It would have been very, very difficult task. Not only in the private sector, even in the government sector, people have gone beyond their expectations or their role to chip in to control this pandemic. So hats off to them all.
A bone specialist could be working in an incubation ward.
Yes,
in an
isolation
ICU,
ward.
In an isolation ward.
ICU, less likely because it's a bit more challenging. But definitely we saw other specialties like ENT, ophthalmologists, orthopedicians, they helping us out. especially the junior doctor level, where you need to, because otherwise the monitorings are, we know what to monitor. We can look at it that way, but this is some totally unprecedented and unseen territory. Even for us, it was different. So great teamwork, and we could do a lot of good work by others people's willingness to help in this crisis situation. It would have been very easy to just back off saying, it's not my specialty, I don't know.
Yeah.
But nobody did that.
That's fantastic. I mean, on the external, I think all you get to hear is, hey, there are a lot of doctors who are not willing to come to the hospital, but those who are willing to be there in the hospital and chip in whatever way possible deserves a lot of respect.
Definitely. I think, in a battlefield, we don't want to run away, but we can't blame. Legally, there were initial issues that you may be served a notice if you don't work. And again, please remember that I was not trained for it. I don't know what will happen. We don't know what quality kit I'm going to get, what will happen to me, my family.
But still, if you have to volunteer to dive in.
Many have done it. There are hardly any instances of people running away. Otherwise, for such a poor doctor-patient ratio, if you have to pull off this pandemic, that itself should applaud the medical fraternity in total, not just the doctors, nurses. The nurses' job, I think, it's impossible to even imagine what they're doing. One instance, for example, there are a lot of nurses who were affected. The number of nurses and auxiliary workers who were affected is much more than the doctors, actually. So when I went to see one of the floor in charge nurses affected, she was sitting, and her colleague was sitting and trying to console an old lady and trying to help her out, feed her, get her hair combed, and try to build her mood. So they have fought even at that level. There are instances where doctors have got up and tried to intubate or provide oxygen or emergency service when they are themselves sick. So I think this can't be taught, and it's easy to criticize any worker, let alone healthcare worker, but these things are inborn and inbuilt and as a part of professional.
That's incredible.
A lot of stories like that. If you would like to add on, some funny aspects of what I did. So once you wear the hazmat suit, whether you're Dr. Manohar or nurse or a auxiliary worker, a junior doctor is or a canteen worker who is getting in to give the food, is not to be discriminated. You don't even know. Yeah. And most of the time we are fogged and we can't see clearly who's there. So once I was entering, and then the canteen boy was holding a glass of juice and telling that room number is waiting and I have to change to come, and I'm scared. So I told, okay, I'll take it. As I was entering, so I took it and gave it to him, and he started hurling abuses at me, the patient, because how long you would take to do and things like that. Then he calmed down, and I told him that, no, I am doctor, actually, I just tried to help you out. So some situations, sometimes you should see the funny side of it. I know, again, we are also emotionally burnt out, but in spite of that, somewhere, of course, sometimes my emotions have run negatively also. I'm not saying it will be all fancy like this, but many times such instances have happened. Why did I give pongal for lunch? Someone was shouting at me, and someone wanted a type of biscuit or brand to be served him immediately. So many times people do understand, but sometimes people forget that once they are sick, they feel they want what in regular times what is happening, you want it to happen now also. So a lot of interesting things have happened there.
I'm sure.
And sometimes one old man was crying, and then we dialed to his son and gave the phone. So then I called him back and said, why don't you give the phone to him? So they possibly didn't have the phone, or sometimes they may have the facility, but he doesn't know how to dial. So again, he needs to depend on the healthcare professional, the nurse or the hospital auxiliary worker or the doctor who comes in, and they may not even know who is who. So that's a very, very different sort of an experience, unthinkable it is actually. There are a lot of people who got better and gave donations and appreciations. Thank you itself is a great thing to do. My mood used to, in such difficult circumstances you worked, is good enough, because many of the times, especially the nurses, have doubled or tripled the duty.
Right.
They carried on because of shortage, or someone has fallen sick, shortage of staff. There are a few people who left the organizations, many organizations, not only ours. So it's a chaotic thing. But then whoever is intended to work and do well have definitely made the difference.
That's truly incredible. And I think a moment goes out to all the healthcare workers, everyone involved. You're so right in saying in a hospital, right from the person serving tea to
Yes.
everyone who is involved,
definitely.
including volunteers. We truly have played it well compared to other countries. Would you say that, Doctor?
I don't think we should compare it that way. But if you look at the population, doctors, nurses ratio, we are nowhere near the developed world. But we have managed it very well.
That's
Because I think Indians are known to work hard. Indian doctors are the most wanted doctors. I'm sure you must have seen some reports in the UK and the US. People wanted to get treated by Indian doctors.
right.
And there was a survey that people who were treated by Indian doctors fared well. I would like to be proud of it. Definitely.
That's something for all of us to be proud of. That truly
So I
is
think
nice.
we have done very well considering such circumstances. Yes, definitely.
Doctor, I really appreciate you talking so very candidly about how the last few months have been. And this is the reason why I thought you'd be perfect for us to be on the show and for us to talk about how the last few months have been and how, irrespective of how overwhelming the entire system has been, still you guys have gone on to do a fantastic job. Let's talk about you as an individual, apart from being a doctor, apart from you being the medical director at Disha India Foundation as well. You're someone who is known to be a fitness enthusiast. You take part in marathons. It must have been a while though since you took a long run,
Yeah.
or are you still regularly hitting the jogging track?
Yeah, I miss the marathon in its true physical sense. That energy of any run need not be full marathon. It's amazing, the feel, the number of people, the color what goes in and the energy. And I really miss it. But a lot of virtual events are happening. So I've been doing some amount of workout. And I think I always advise in this moment of distress, never change your routine too much. Of course, we have some restrictions. So I continue to work out at least 5 days a week, 1 hour a day, and continue to run maybe on weekends only. But I'm doing it. I'm proud of it. I'm motivated a lot of people, and a lot of people are motivating me to do this. And being fit is our own responsibility.
So true.
And especially in this pandemic, nutrition, exercise, good sleep, balanced diet is as important or more important than, of course, the precautions what we take. So we should keep the balance going. Try not to change your activities of daily living too much. Otherwise, it will start affecting you and keeps pulling you down mentally.
And you're not answerable to anyone else but yourself
Yes.
on how you take care of yourself physically.
Yeah, the only life partner for you, as per Bhagavad Gita, is your own body. And you've got to do everything for your life partner. That's your own self.
That's so very correct. Doctor, let's say in today's scenario, if someone feels they're doing great, they feel they are healthy, should one go get themselves tested, or is it not really required if you're feeling all right?
Oh, I didn't get your question. Do you mean that you don't have symptom, you want
Yes.
to test it, or
Yes,
you want to?
you don't have symptoms, but it's been over 9 months now, and a lot of people are now starting to think that, wait a second, what's happening with me? Maybe I have got it and I recovered. Should I get myself tested or should I not? What would you like to say about it?
Yeah, I can gauge why you are asking this. There are a lot of 50% of the patients could be asymptomatic. Did I get the disease without my knowledge and I'm immune to it? Is a question what comes in. Like as per the guidelines, we need to test only if you are symptomatic as of now. Again, as I said, this is a pandemic situation. We remember sometime that people were testing randomly also to find, but that reason is different. To look for herd immunity or how much is the spread of the disease in the community, then for that testing is different. For an individual perspective, I don't think we need to test if you do not have symptoms. Strangely, as I said, this disease is an elusive disease. Many of our colleagues have tested positive and they wanted to give their plasma to help out the other patients. There are a lot of patients, a lot of doctors who have done it, a lot of other patients who have done it. So some of them, when they went to test for their antibodies, it was not there.
Right.
So we were all surprised, like what happened? Like he is definite confirmed case. He suffered quite a lot. is recovered, but antibodies are not there. So that also can happen in this disease. There are two types of immunity what I can develop against any disease. One is called the antibody-mediated immunity, which is measured by the testing. The other is called the cell-mediated immunity, which can't be measured by testing. So someone who has recovered can still have absence of antibodies. He may not have antibodies, but he may have immunity.
Wow.
Again, the problem of reinfections is surfacing. It's been in press for some time. Well, to definitely know if someone is reinfected, you should have a detailed genetic study of the virus in the first time and also in the second time. In the given context, it's very tough to do it. Having said that, what I personally believe is there is less likely chances of reinfections, because for the lakhs and lakhs of cases all over the country, we should have thousands of reinfections at least, if at all. And recently, the British journal has released a study that they are also saying it's very, very unlikely to have reinfections, especially within the 6 months. That is what the data is available. So I hope there is no reinfection. I don't think there is a reinfection.
So as mysterious as this virus is, we still have plenty of reasons to be optimistic.
Yes.
And
we should be. Optimism is the only thing which can carry forward us, isn't it?
Right. Absolutely. Doctor, finally, what would you like to say? You did stress on SMS. You did talk about how just a thank you sometimes can really make a doctor's day. Apart from, of course, having you come in, talk about the current day situation. I think doctors these days have become experts at communication as well, because that is very much required in your field.
Definitely.
It's not just being an expert in medical science, but also communication.
Yeah, you're so right. In our curriculum, we do not have anything about communication. We do not have anything about communication. How do you have to communicate to a patient? How do you have to communicate to your other colleagues? So that I always stress upon. Maybe sometimes we need to have it in the internship at least to make a better living. And also we need to educate doctors to inculcate other habits. Unfortunately, many of us work and work and work. We do not have any extracurricular activities or hobbies. So that also would come back and haunt us. Coming to the pandemic situation, the public, if you want to look at everything in one nutshell, like such days were so gloomy and difficult. Many of those have done really well by following the rules and regulations. But again, the onus is on individuals to do well for them and also to look around and see if they can make a difference, maybe monetarily or even emotionally. That's very, very important, emotional quotient. Because so long staying at home has played havoc even within the family. We may be life partners, but we didn't expect so much of partnership for such small duration for longer time in a day, isn't it?
Yeah.
So that itself created a lot of turmoil. And we have some studies that especially the ladies in the family were overstressed because of this. Even the kids, my kids are like, they want to go to school now. They had enough of the laptop or the
work
phone.
from home scenario.
School from home also started. So a lot of things have changed. Somewhere keeping ourselves mentally positive. Of course, there are a lot of people who suffered losses with respect to businesses. A lot of people would have lost their jobs. The life was never the same for many of us. But somehow that's why sometimes breaking the lockdown also becomes very important, is what we feel, isn't it? So we need to balance life and livelihood, as I said. So I think a lot of things to think over, and it also should teach us a lesson, like in life such crisis can come.
Yeah.
We always talk about positive things. A negative thing could possibly teach much more how to handle a crisis situation. And this is not the end of the world also. Life would go on provided you keep strong during this situation. More importantly, all the preventive precautionary measures has to be followed. If the vaccine comes, yes, definitely good. We'll take it. And I think especially travel has been much, much less. I'm also itching to travel out again more freely.
Yeah.
So I think all these changes has to be inculcated. And if we all put our heads together, I think it will do good for the country and for the world. Vasudhaiva Kutumbakam, as we say, world indeed is a family. There are a lot of people who take things differently. There are people who are throwing corona parties, I heard, and it sounds stupid, but by and large, most of them are responsible and they have worked towards it.
Well, I guess 2020 was supposed to be the year when people have more, they achieve more. I think the year has now given us an eye opener that we need to appreciate what we have more than anything. And for a better 2021, I once again thank you, Doctor, for all your services and being such a fantastic individual to come here and to start our podcast with like this. Thank you. I would love to get your thoughts on medical services, overall medical health in India. We have so many places that I'd love to explore opportunities and get more of your views and points on. We'll do all of that in the few days to come, I guess. But thank you once again.
It's my pleasure to be here. I remember the last time I came, I looked much different. I'm sure you would agree. There's a lot of stress. And the day I came here, it gave me such a good break. I'm not exaggerating. It was so much of amidst thick of things that I didn't even have time to just look back what was happening to myself. And that program gave me a good break of few hours where I relaxed and I went back home looking very different. I'm always there and I hope we do good to the society. Let's join our hands and make a difference to the society. Roots are the places which should be the strongest link, and in our country, roots are the weakest link. I'm talking about going back to the native. So I'll be interested in doing anything to make a difference to our country and to the world. Thank you so much.
Thank you, Doctor.